The following portion of Daytime Tri-Cities is sponsored by ETSU Health. Once again, it is time to meet your provider with ETSU Health, and today we're talking to Dr. Chester Ogborn. Doctor, we appreciate you taking some time with us today.
My pleasure.
Let's talk about your journey. You're a pulmonologist, and more specifically, a pediatric pulmonologist.
Yes.
Talk about becoming a part of ETSU Health. How did you get here?
Well, I've practiced in a variety of settings in the past, both in academic and in private practice, and it's been really kind of invigorating for me getting back involved with an academic setting where there's learners, there's medical students, there's residents, and all different folks that are at different stages of their education, and so that brings a lot of energy to me.
Right.
I find I'm getting asked questions that are I probably wouldn't have thought of on my own, so it kind of forces me to think about things in a way that I probably wouldn't have, which I think is good.
Do you like the hands-on, seeing patients, or do you like the teaching side of things, or is it just a combination of both?
I don't really see them as all that separated.
Yes.
That's kind of the fun part about medical education is you can't just sit and read books and become a good doctor. You have to learn how to talk to people that are from different walks of life and different backgrounds and be able to communicate clearly. You have to be able to express yourself and explain what you want to have done for the patient, and also generate some trust where there's buy-in from the family so that we're all on the same page and trying to do the same thing. So I think when you're trying to teach someone how to do those skills, you have to be actually doing it hands-on.
Kind of break it down for us. First of all, pulmonology, kind of describe what you, as a pulmonologist, what you deal with, and as a pediatric pulmonologist, break that down even further for us.
Yeah, pediatric pulmonology is a little bit different from adult pulmonology. People think of adult pulmonologists, they're a lot of times in the intensive care unit a great deal of the time. In pediatrics, there's a separate specialty for critical care. So I see patients in clinic a good portion of the time. I do consultations in the hospital. I certainly do take care of patients that are in the intensive care at times as a consultant, but I don't live in there. A lot of my patients may have, relatively mild problems, like such as a nuisance cough that doesn't seem to go away, but I also take care of patients that have chronic illnesses that are going to be lifelong, where we're trying to maximize their health and help them reach their potential.
Talk to me about some of the things you like to do outside of medicine.
Yeah, we just moved down here from the Montana area, and we're thrilled to be in the Appalachian area. I love the outdoors. I've been really enjoying this fall.
Oh yeah.
The dazzling colors changing, just kind of, I'm already falling in love with the area. But I like to hike. I've got 3 small little dogs, little toy poodles, and they're enjoying our home that we just moved into. They're exploring around the yard, and I enjoy cooking.
And as far as your specialty of pediatric pulmonology, is it kind of rare to have someone in an area of our size, our demographic? Is it rare to have someone with your specialty here?
Well, you definitely need a large enough population to support a specialist, but no, this area, I think there's enough population and patients here for probably at least a couple full-time people, maybe more, not sure.
When you look for yourself and professionally, and you look down the road a little bit, what are you hoping to accomplish in the future? What would be a good, successful outcome for you as far as your profession is concerned?
I'd like to leave some footprints, I guess.
Right.
By the time I'm done working, I'd like to feel like I helped impart a little bit of the things I've learned on people that go out and practice in the community too. And everyone has to develop their own style of how they can be themselves and do a good job as a physician. But I feel like there's some skills and little nuances that I can share, and of course the special knowledge of pulmonary medicine that I'm immersed in. That a general pediatrician still takes care of kids that have all the same problems I do, but they don't have the luxury of being able to focus just on the respiratory side of things like I do. So I probably have some insights and little tricks that I can pass on.
All right, Dr. Chester Ogborn, thank you so much.
Thank you.
Folks, Dr. Chester Ogborn, this week's Meet Your Provider with ETSU Health. The preceding portion of Daytime Tri-Cities was sponsored by ETSU Health.